Hi there. Welcome to the webinar. I'm Jason Jordan. I'm a Director of Medical Cannabis Research Australia and a prescribed patient who takes medical cannabis every day to treat the symptoms of multiple sclerosis. Now, like many people, when I was first introduced to cannabis as a treatment for genuine medical conditions, I was skeptical. I was told my whole life that cannabis is a gateway drug and has no valid uses. Well, I'm happy to report that I now know that's wrong, and that it not only has clinically proven benefits, in many cases it can be used in place of far more dangerous medicines, like opiates. Many people who are considering medical cannabis today are doing so because their existing treatment regimes require an ever-increasing amount of substances, or because the medicines themselves have so many side effects, it sometimes makes you wonder if the treatment is worse than the underlying condition. Consider how easy it is to overdose on opiates. Look at how tramadol turns people into zombies. And think about this, taking one full packet of paracetamol in one go can make your liver fail. And then consider that it's physically impossible to overdose on cannabis. If we consider the principle of least harm, cannabis is by far one of the safest medicines that we know of. In this webinar, we've brought together some expert medical professionals and people with a direct lived experience of medical cannabis. Dr. Bonni Goldstein is a Harvard-educated PhD who's known around the world for her knowledge and experience in treating developmental issues and other psychological issues in children. Bonni is considered a rock star in the world of neurobiology, psychology, and counselling. We're also joined by Dr. Stephen Chalk. He's an Oxford and King's College trained Perth-based GP who's taken the lead in identifying patients who will most benefit from medical cannabis. Stephen has direct experience of patients who have seen demonstrable results in conditions such as chronic pain, insomnia, PTSD, multiple sclerosis, anxiety, dementia, and autism. Dr. Barbara James is a child and adolescent psychiatrist who practices evidence-based therapies with a focus on nutrition and lifestyle changes. Working out of the Alfred in Melbourne, Barbara doesn't just treat the individual, she helps the entire family of the patient. With all of the choices available around medicines, Barbara has identified medical cannabis as a powerful but safe alternative to the drugs that can often make patients reject treatment. Sharlene Mavor is a fellow director of MCRA and a medical scientist. She'll provide clinical evidence around the efficacy of cannabis in treating the symptoms of autism, as well as letting us know about the current trials happening right around the world. We also have two interviews with parents of autistic children. Catherine and Burton have very kindly agreed to share their experiences before and after the introduction of medical cannabis. Having spoken to them previously, I think you'll get a great deal out of their experience and passion for what can only be described as life-changing treatment for the entire family unit. It looks to be an amazing session. Please stick around till the end as our presenters will be part of a live Q&A. You're welcome to submit questions during the talks and we'll answer what we can immediately. The rest we'll put to the panel during the Q&A. Now, before we get underway, please keep in mind that everyone here tonight is a volunteer. No one is being paid. We all give our time to you because we genuinely believe that everyone should know about and have the opportunity to see if medical cannabis will work for them. Please engage with your doctor for further information. And remember, this is a legal treatment with thousands of prescribed patients right here in Australia and the world. All right. Let's go.
Thank you so much. It's a pleasure to be here. I'm happy to share my experience. I don't have a huge amount of time, but I'm very happy to take any questions at info@Canna-Centers.com, as you can see on the first slide. Please, next slide, please. Just a little bit about myself. As you heard, I went to medical school in New Jersey, moved out to Los Angeles for the sunny weather, and did my training there, was a critical care transport doctor, pediatric emergency medicine, and as Richard said, I've been a cannabis specialist since 2008. I just recently authored Cannabis is Medicine, which just published last month, and In my career as a cannabis physician, I've seen over 18,000 adults and over 1,000 children. Next slide, please. Now, I'm going to move right into it. So current treatment options for children with autism. So in Australia, there's only one approved drug, which is an antipsychotic. In the United States, we have 2 approved drugs, one of which overlaps, the other, again, an atypical antipsychotic. We know these drugs to have serious adverse side effects, both short-term and long-term, including weight gain, diabetes, drowsiness, and other serious difficult side effects. And very importantly, these drugs have been approved to just address the irritability of autism. They really do not address the core symptoms. And this is a driving factor for the search for other treatments with less serious side effects, but also those treatments that might address the core symptoms. There are a number of other drugs that are being used, such as SSRIs, like antidepressants, stimulants, antihistamines, other medications that treat anxiety, other types of antipsychotics. But when you review the literature, which unfortunately I don't have time to go through, the overall response is quite poor, and really what's ending up happening for most of these families is that their child is sedated. These families report that they are not seeing the best version of their child. And as reported in 2005, parents are unhappy with conventional options that don't address core symptoms, and this is one of the main reasons why patients turn to complementary or alternative medicines. Next slide, please. Now, the big question is, why cannabis? Why would we even think about cannabis for a child with autism? And so everything boils down to what we call the endocannabinoid system. This is a major physiologic regulator of our chemicals in our brain and in our body. And basically what this slide is showing you, if you can look at the kind of blue round cell, that's the presynaptic neuron, it's labeled. This is a cell in the brain that is sending a message to another cell, which is represented by the pink cell at the bottom, the postsynaptic neuron. So these are brain cells talking to each other. And how do they send messages? They send what we call neurotransmitters, which is represented by the purple circle with the NT. That's a neurotransmitter. And many people have heard of neurotransmitters: serotonin, dopamine, norepinephrine, all these types of chemicals that basically send messages and tell us how to react, how to interact, how to behave, how to feel. So what's happening is cells send this message. And I know when I went to medical school, I learned that this was a one-way street. And it turns out that in 1988, scientists found a receptor, which actually they had kind of known about, and they called it an orphan receptor. But it turns out that this receptor is where the compound from cannabis, THC, was found to bind to. Now, scientists knew that we did not have this receptor for THC, because every receptor we have in our body is because we make a compound that binds to the receptor. And it's like a key in the lock mechanism, which I'm going to show you. Now, interestingly, it turns out, as I learned the wrong way, that it's a one-way street. It turns out that our brain and many cells in our body make compounds that look just like the compounds that occur in the cannabis plant. We are kind of pre-programmed to accept these molecules from the plant. The receptors have been located in many places throughout the body, involved in almost every physiologic system. But interestingly, they have density in the brain, the gut, and the immune system, which happen to also be 3 of the main systems where we have found issues in patients who have autism. They usually have, of course, brain function issues. They have 4 times more likely to have gut issues, and they've also been found to have a significant amount of inflammation and immune dysfunction. So it's an interesting overlap. So the take home from the endocannabinoid system really is the signaling system, and its job is to kind of give feedback to help our cells maintain a balanced message. If you're off, your endocannabinoid system kicks in to try to balance messages. Next slide, please. So the endocannabinoid system is made up of receptors. We've identified what we call CB1R, the type 1 receptor, CB2R, type 2 receptor. We suspect that there are more. Type 1, an easy way to remember it, is in the brain. Type 2 is more in the gut and in the body, immune system. Endocannabinoids are your inner cannabis compounds. So like I said, we make compounds that look like and act like the compounds in the cannabis plant. And anandamide is one of the first ones to be found, and it is highly studied. 2-AG is the second one that was found, and there's a few others. 5 total that we kind of know about that are like what we call the classic endocannabinoids, but there are others. And then the other part of the endocannabinoid system, which still is being researched because these are great targets for treatment, are the enzymes that make the endocannabinoids and break them down. Please click. So anandamide, focused on that, click again, please. What's interesting about anandamide is this is a compound that our bodies make when we need them, when we're stressed, when we have an insult or injury or infection. And it turns out that there are now a number of studies. Please click again. The first study being shown there on the left is out of Stanford University here in California, and the other study from Israel showing that children with autism have lower circulating levels of anandamide. And in the study from Israel, they checked on a couple of other of the endocannabinoids, which were also low. This is, in essence, a deficiency. And if these compounds serve to play a role in maintaining balance of cellular messages, and you do not have enough anandamide, your body cannot respond to all the various stressors that come, and you are now in a deficiency state. And understand that this is kind of the science behind why we may look at cannabis for autism. Next slide, please. So how does it work? Here is a receptor. As you can see, this kind of large receptor. They're saying CB1, CB2. That's what it looks like. THC fits like a key in the lock. Okay, click please. And we have endocannabinoids that also bind. So we have the receptor for anandamide, for our endocannabinoid, but THC happens to fit into that lock. Now we have CBD that also interacts with the receptor, but it doesn't interact the same way as THC. Click, please. And this is why we say THC targets the receptor, but CBD targets this receptor kind of as a traffic cop on the sideline, regulating. It helps regulate anandamide, but also it's known to have over 65 different targets in the brain and body. Next slide, please. Okay, I'm going to go quickly through the literature review. What do we know about autism and cannabis? So there's a case report from 2010 of a 6-year-old boy that was given 3.6 milligrams per day of THC, and over 6 months, he was checked by his parents, a physician, as well as an independent rater. And what ended up happening was they found that over this time, and this, by the way, 3.6 milligrams throughout an entire day for THC is quite a low dose, significantly decreased hyperactivity, irritability, lethargy, and so on. They saw improvement in this boy with really no side effects. And then these other studies that I've listed here, which you can Google, these are studies that have been done in animals and in looking at DNA that have linked the endocannabinoid system with the genetic and other aspects of autism. And it's a lot to go into, and I don't have that much time, but there's now this small but yet important body of evidence that shows that the endocannabinoid system and the potential etiology or beginning, why people have autism, but certainly the manifestations of autism are linked. Next slide, please. So human studies, please click. All right, great. So in 2013, Siniscalco and that group was able to draw blood on children with autism and also the group of control, what we call neurotypical children. And remember that your type 2 cannabinoid receptors, as I mentioned, are all over your body, including on immune cells, which are white blood cells that make up your immune system. And if you can look here at the graph on the left-hand side, you can see for the control patients, the children who were neurotypical without autism, they had 100% basically normal gene expression of the various components of the endocannabinoid system. And when you look to the part of the right, you can see AD is autism disorder, that those patients clearly had abnormalities within their the components of their endocannabinoid system, both in receptors and also in enzymes that make your endocannabinoids and break down your endocannabinoids. Click, please. Now, a study from 2018, and this is the study that I reported earlier, this is from Stanford. They figured out a way to measure plasma anandamide levels. And one thing I will share with you is it's very hard to measure these levels. Remember, you make these compounds when you need them. Your body uses them at the receptor, and then they are broken down. They're not just floating around to be found easily. However, they figured out a way to measure these levels in children with autism, and again, in a control group of neurotypically developing children. And what they found, as you can see on the part of the graph to the right, is that the children with autism, ASD, and blue bar, were lower. Their levels were statistically significantly lower than the anandamide levels in the control group, such that the anandamide concentrations differentiated cases, meaning the scientists, without looking at the patients, were very accurately able to predict which child had autism based on a blood test. This is exciting research because this may just be a biomarker for autism so that we can identify patients earlier, but it again reinforces the idea that there is an endocannabinoid deficiency or dysfunction in these patients. Next slide, please. Now here's the study out of Israel, and as you can see, there is a 3 different bar graphs here. So the first one, if you look on the side, it says AEA. That's anandamide, and you can see that very similar to the study from Stanford, they found that children with autism had lower levels of anandamide, and then OEA and PEA are 2 other types of endocannabinoids that they were able to measure. And what they found was that these patients had also had statistically low levels of these endocannabinoids. Now, what's interesting is that they compared very similar group, 93 children with autism, 93 controls. Both groups were 79% male. Both had severity scores very high. However, one of the differences, 80% of the autism patients were on medication. And I'm not going to be able to show you the other part of this, but the medications that these patients were taking had no influence on the endocannabinoid system, meaning it did not help increase the levels of anandamide or these other compounds in these patients, serving basically a purpose to kind of medicate the child, but without addressing the deficiency. Next slide, please. Now, I took 4 studies that, as you can see, came out just within the last 3 years that were basically retrospective studies of children who were given some form of cannabis medicine for autism. So the first column that says 2017, you can look and see they had 21 patients. They used mostly a balanced CBD THC, like a 1-to-1 type ratio. They had some patients with CBD dominant, some THC dominant. Duration of treatment was a little more than 7 months. And you can see, again, outcome here. So 14 of 21 patients, about 2/3 had very much or much improved, and 6 out of 21 minimally improved. And when you look at dosing, you can see these doses, as far as I can tell, these are on the low side of dosing. I have patients taking much, much higher doses. Benefits, 66.7 showed improvement in at least one core symptom, improving sleep, less food rigidity, and so on. Some adverse effects, notice very low, only 3 patients, and understand that it was resolved with a strain change. That means they just switched out their cannabis product and they were able to resolve the issue. And I will share with you that cannabis does have this flexibility where, because of the genetics of the plants, you can get different effects using different strains. The next study is out of Israel. Again, they had a group of 60 patients. They were given 20-to-1 ratio, 20 parts CBD to 1 part THC. And if they had no response, then what happened was they added in some THC to lower that ratio down, and they went as low as 6-1. These patients were treated for, on average, about 11 months. 31, almost a little over half, that's 52%, responded to the 20-1. However, those patients who did not respond, who got the lower ratio with more THC, that increased the response rate from 52 to 67%. Another 20 patients had benefits. And as you can see, only 9 out of the 60 either had no change or had some problems using the cannabis. And again, that doesn't mean it wouldn't have worked for them. In real life, we would try another product for that patient. We would not say they're non-responder because it can be strain related. If you look under benefits for this, you see outbursts, 61% improved, anxiety, almost 40% of patients reported improvement, communication, almost 50%, stopped or decreased other medications, 57%. And when you look at adverse effects, certainly fall within what we accept from medicine: sleep disturbance, restlessness, loss of appetite, or GI issues. Now, moving on to the next two, these are both out of Israel. Oh, I'm sorry, both out of Israel. And I'll just go briefly. Mostly these were high CBD. Israel seems to want to lean towards high CBD products. And again, duration was at least 2 months or up to 6 months. And as you can look at this, what you're seeing is pretty high numbers of improvement in self-injurious behavior, hyperactivity, less agitation, and so on. So we now have this body of evidence here, despite it's retrospective and not placebo-controlled. However, it clearly shows that these patients have quality of life improvement with very little adverse effect. Next slide, please. All right, so the benefits of cannabis treatment is reported by my patient group. But crossover with what I just explained: less anxiety, less aggression, less temper tantrums. So what we're seeing is less of the unwanted behaviors and improvement in the behaviors that we do want. We want these children to sleep. I have parents who have had to hire nannies to stay up with their children at night, and that does not work well for a family. So to have a child get better sleep as a side effect is terrific. Better speech and communication, better focus, improved school performance, less food rigidity, better eye contact. If your child is able to participate in therapy, now you can put the puzzle pieces together to have your child do well. Side effects, and I put it in red because I find the side effects are temporary and easily reversible. It just wait for the medicine to wear off. And then we can resolve it by changing the dosing, the timing, the product, trying to fit that child's individual response with a product that fits their chemistry. Increased restlessness or hyperactivity is often something that we see sometimes if it's a CBD dominant. Believe it or not, that can be overcome by increasing the dose or adding in THC. Increased emotionality I have seen in some patients, and again, sometimes that's a strain. And then certainly intoxication. I'll share with you, no parents in my population that I treat will tolerate intoxication. If their child looks intoxicated, we've either gone too high on a dose or it's the wrong product, and we can change it. Again, everything here is reversible. Next slide, please. All right, last slide. Considerations. One size does not fit all. Response is individual despite similar symptoms. I have patients that respond beautifully to THC. Some respond to CBD. Some respond to both. Some respond to other cannabinoids that are available in California. Something to be clear of with CBD is lower doses can be overstimulating for children with autism. Not all of them, but I have seen it, and it's not rare. And what ends up happening is that if you bump up that dose, sometimes what you can get is more calm and focus. So that's what we call biphasic. Low dose does one thing and high dose does another. If low doses aggravate conditions, you must try a higher dose. I do find that in the vast majority of my patients with autism, a combination of THC often gives better results than one or the other. And then one other thing is to remember that these are growing and changing, developing human beings, and that if we find good dosing and a good cannabinoid combo, as these children grow and change and their brain develops, we may need to tweak things. That is part of cannabis medicine. And I think that's it. Next slide. That's my last slide. These are just some of the patients I've been honored to be able to help and take care of. So thank you very much for your time.
Now, many years ago, I say many, not that long ago, a few years ago, we actually had one of our seminars at Curtin University, I think. And one of the people who actually attended there was Catherine. And Catherine has a son, Carter, who has some issues with autism. Catherine has a bit of a story to tell about how she came to medical cannabis, but I'll let her tell that herself. Hello, Catherine. How are you doing?
Hey, Jace. How are you?
I'm really, really well. Feeling better than ever. I'm going to let you tell the story because it's always really interesting. But before we get there, let's just briefly talk about Carter and your experience with his treatments up until the time that you came across medical cannabis.
Hi, everyone. My son, Carter, is nearly 9. And just to head things off at the pass, he is autistic. He has cerebral palsy. He has Ehlers-Danlos syndrome. He has a feeding tube. Carter didn't speak until he was 4. He has had chronic pain all of his life. He has varying behavioural, sensory, emotional regulation issues since forever. He was globally developmentally delayed until he was diagnosed autistic at 5. So for many, many years, he didn't speak at all, other than really baby gibberish. We did a lot of speech therapy, never really got anywhere. And there was a lot of frustration around his lack of language because he's incredibly intelligent. A lot of people think non-speaking means you have nothing to say, which is just not true. He, although he was non-verbal, he was and is still incredibly intelligent. For example, he's reading Year 9 history. So he's a very smart little boy, and he always has been, but being able to communicate in a way that the outside world could understand was very difficult. To give you an example, so far he has been on Tegretol, gabapentin, oxycodone, baclofen, diazepam, clonazepam, clonidine, and various other drugs. They wanted him also on risperidone, and that was a big no for me because I had done a little bit of research and I was quite concerned about how dangerous it was for someone his age.
Was he hurting himself as well? I mean, to put even an adult onto some of those sorts of medicines it's a huge decision to make because these are, well, I won't even call them toxic, but they're potentially fatal drugs as well. I mean, you can overdose on these ones.
For diazepam, for example, currently he is on 15 milligrams a day. That is a phenomenal dose of Valium, which is what diazepam is. He is on very high doses of gabapentin. Gabapentin is a usual, pretty standard go-to nerve pain drug, but it's also used for epilepsy as well. He does not have epilepsy. So about I think it was August or September maybe, that I came to the conference that you were speaking at Curtin, and I brought my son's physio, who I hope is tuning in. If she is, hello. She came to the conference with me and we heard a whole bunch of doctors speaking, and then this fella walks down the stairs with his walking stick in his hand by his side, not under his hand, just like tucked under his arm, and he starts speaking, and I'm thinking, oh, this would be interesting. And he goes on to tell us about his condition and where he should be and where he is very much not. And I then saw Jason run up the stairs, which by all accounts he should not be able to do. He then whipped out this little bottle out of his pocket of his prescribed medicinal cannabis, and my jaw hit the floor, because while my son's condition is very different and it's not considered a degenerative disease, as he's getting older and he's growing, his body is breaking down. He's now developed secondary arthritis. So I was watching you run up these stairs just going, what? How is that possible? And my son's physio of many, many years, just looked at me and went, what are our options? Because all they've ever really done is just increase, add all these different drugs. And I very much don't want my little boy on such dangerous medications, because not only are they have their place, they absolutely do, and I'm not anti-medication. They have got him to this point, and I'm very grateful. But I know that I now know there is a much better option for my son.
Are you not concerned that your kid is going to grow up to be a drug addict and, someone who is dependent on cannabis?
You want my really honest answer? I'm actually much more concerned about him becoming so dependent on benzos and opiates that he dies. When we started, he was about 19 kilos. He had been underweight for most of his life because he has extremely restrictive diet with his autism. So he eats toast, he eats chicken and rice, he eats chocolate, one specific brand of chocolate Yogo, pizza, and chicken nuggets and chips. That's it. He eats nothing else. He was about 19 kilos in 2019. By January 2020, I think it was, he had gained 20 kilos in a year.
Wow.
Yeah.
That's great.
He had tummy rolls. He was pink. His skin looked healthy. He didn't have dark circles. And this was just with CBD without THC. And we still obviously had a lot of trouble with pain because it's not a cure-all. And I don't want people to look at us and think, oh, wow, it's a miracle, because it's not. He is still very much autistic. He is still very much physically disabled and struggles every day. But it has made a phenomenal difference.
It's stupidly expensive. You may have to do it for the other child as well. Is it worth it?
For us, yes. My husband was an avid football card collector. He sold everything so we could afford it. Now, this leads me to the second part of our journey. So we were spending between $800 and $1,200 a month. That includes the appointments to see the private specialist, because at the time, prior to Mark McGowan's announcement, I think it was March last year, that access to cannabis would become easier. Veiled threats of child protection and DCP and drug tests. They didn't actually do drug tests, but those veiled threats were leveled towards me, which are terrifying for a mum who's just trying to help her child, who over the years has expressed a number of times that he just wants to die. I can't explain to other people what it feels like to have such a little child from the age of 6 or 7 say that they want to die because they're in so much pain. It's horrific, and it's incredibly traumatic for him and for his siblings and our family. So again, I contacted you and Sharlene and a couple of other people about some options, because I had some adult friends with Parkinson's and motor neuron disease and things that were needing some help. And in that list, I found our current doctor, who's currently on the panel as well. Hi. At one point, our paediatric specialist removed his support because of red tape with our children's hospital, and we see him publicly, so he was not able to publicly support us, which was very disappointing. But I do understand, because the first night he was on about, I think it was 5 milligrams. By the time we got to 5 milligrams of THC and 5 milligrams of CBD, as we titrated up, he slept 12 hours.
Wow. Okay.
He had never in his 8 years slept 12 hours, not even when he's had pneumonia, not even when he's been gravely ill. After we got to his regular dose of 10 and 10 dosage, we were able to go to the park. We were able to go to the movies. We were able to leave the house without a meltdown. And still, again, he's still autistic. He still has limits. This is not a miracle cure-all. He still has days where he just needs to lay in a dark, quiet room and bury himself in his world, and that's perfectly acceptable.
So would it be fair to say, Catherine, that that we haven't fixed the problem? What we've fixed is his quality of life.
Absolutely. His quality of life has improved prior to surgery, tenfold at least. And he was able to start communicating better. When he first started cannabis in just CBD in 2019, he had this blossom of development. And I don't know why. I'm not a doctor or a scientist, but because he can now hold a conversation, he can now communicate more effectively. And he still has times where he completely shuts down and becomes nonverbal, and we revert back to using his communication device. But instead of him being frustrated, he's able to sort of, his words are, my brain slows down, mummy. It doesn't feel like it's racing a race car all the time, and I can think. And
how do you know it's the cannabis that's doing this?
Because it's the only thing that's changed. When we have added and removed other medications in the last 2 years, cannabis has been the only thing that has helped. And the big difference, I think, for me is, and I'm not sure if you have this experience, obviously I'm human, I'm not perfect. There have been occasions where I have forgotten or missed a dose or whatever, for whatever reason, or it's late. We now have it timed pretty perfectly. So if we give it at approximately between 7 and 7:30 in the morning, he's good until about 1. And then we start to see a bit of a drop-off. And so we see an increase in pain, a drop-off in mood. And then, so we've worked out if we give his next dose at 12:30, we don't get that. And by drop-off, I don't mean a severe drop. It's been something that I have just started tracking in the last few months. But, for example, if I don't give him his nighttime dose, he's awake until 11 o'clock. If I give him his nighttime dose between 6:30 and 7, around when he has dinner, he's asleep by 8:30. If I don't give it to him, he is wide awake, even with clonidine, even with diazepam, even with gabapentin, oxycodone, all of those different drugs. He can be awake well into the night and wakes multiple times until I realize, why is he awake? So, oh, that's right, I forgot. Oops. And it's a real penny drop moment. But I'd like to say, for other people, I've highlighted the original cost of $800 to $1,200 a month. Currently, we spend under $400 a month. So that, people ask me all the time, oh, Carter must be really high. I can tell you right now, compared to all of the other drugs that my son has been on, this is the least high inducing.
I've said the same thing. Other people who are just on opioids who are far higher than anything I've ever experienced on this medicine. Catherine, we're going to have to move along because we're outside for time. Are you happy to stick around for the Q&A in case anybody's got any questions to ask?
Yeah, of course. Happy.
Wonderful, wonderful stuff. Thank you so much for talking to us, and thank you for sharing what is, some really personal stuff as well. And if you could say thank you to Carter, we do really appreciate the fact that he's willing to.
Hopefully one day he'll be confident enough to speak himself. So he's.
Good evening. Thanks for having me here this evening to chat to you. My name is Dr. Stephen Chalk. I'm a GP. I'm a cannabis prescriber, and I'm medical director for a licensed cannabis producing company called Canna-Centers, based here in WA. So tonight, I'd like to present to you the case of little Kay as an illustration of cannabis treatment in autism spectrum disorder. Now, Kay is an 8-year-old boy who I've been looking after for a year or so. And first I'm going to tell you his background and his early history, and then I'm going to move on to talk to you about how he presented to me, how he presented before his cannabis treatment, and then talk about how he progressed when the treatment was started. So, Kay is a middle child. His older brother and his 2 younger siblings have some or all of ADHD and autism spectrum disorder, learning difficulties and hypermobility of their joints. And interestingly, also his mum has ADHD and likely autism spectrum disorder, and his dad certainly has autism. Now, Kay himself, he was born at 37 weeks, which is full term, and he was born in good condition with normal APGARs. But within a few hours, Mum thought maybe there was something a bit unusual about him. He was twitchy and would twitch and move in a funny way. He had poor latching and poor feeding. And as he went on, he was slow growing and he was slow hitting his developmental milestones. All investigations that he had, including metabolic screening and genetic screening, were all normal. But he was floppy and he struggled to keep his head up even as a toddler. He had failure to thrive, so initially he was nasogastric tube dependent for his feeds, and then later he had a permanent PEG tube inserted, which means he had a tube passed through into his abdomen, into his stomach to feed him permanently. Mum was told to start with that he had a diagnosis of alternating hemiplegia of childhood, which is rare and rapidly fatal, but he obviously survived for too long for that to be possible. So then he was given the diagnosis of dopa-responsive dystonia and treated fairly successfully with L-dopa, similar to Parkinson's treatment. So as you can imagine, for Kay's mum, he was very hard to care for, and it must have been very hard work. He cried all the time. He didn't speak at all until the age of 4, and sometimes he was floppy and couldn't sit up. Sometimes he had severe, painful spasms of his muscles, and no good diagnosis was given to explain all these things. But of course, Mum kept pushing, and after seeing a whole full spectrum of private specialists and subspecialists, finally around the age of 5, little Kay was given the diagnoses of severe autism spectrum disorder, cerebral palsy, which is related to damage to the brain either in utero or during birth, and that can cause muscle spasticity amongst other things, and Ehlers-Danlos syndrome, which is a genetic condition which causes very, very elastic connective tissue in the body and therefore very hypermobile joints. So the joints can be very painfully unstable, and there can be joint damage. It's often a very painful condition. Mum found that just no treatments would work for Kay. They were either inadequate and gave inadequate relief, or they had severe side effects. So he tried all kinds of medications, including sedatives such as diazepam and clonazepam and others, several or many even opiates, some antispasmodics such as baclofen, and some anticonvulsants like Tegretol and gabapentin, but none of those were really particularly helpful. So he was in constant pain. He struggled with joint pains, spinal pains, hip pains, painful spasms of his legs, and headaches. He struggled to communicate. He couldn't regulate his emotions. He had regular meltdowns due to frustration around expressing himself. He struggled to tolerate almost all normal stimuli. And he had aggressive outbursts, which finally was worked out. It's probably down to all the pain that he was in. And so Mum kept searching for treatments for him. And finally, she managed to get him started on a cannabis-based treatment a couple of years ago. So initially, this was a high-strength CBD isolate in an oil form. And he tolerated it very well, and they rapidly titrated him up to around 300 milligrams of CBD per day, divided into either 2 or 3 doses. And he tolerated it very well, and rapidly some improvements were noticed. So they found his pain settled somewhat. His joint swellings and joint pains seemed to settle. His bowel habit improved from severe constipation needing multiple laxatives every day to once a day normal soft bowel motions with no treatment needed. His sleep improved at night, and previously he was waking 20 times per night, which you can imagine would be exhausting for the whole family. And that decreased to around 5 times per night. His behaviours slightly improved, and he became slightly more able to self-regulate in both his anxiety and his emotions. And his teacher at school noticed that his learning improved as he began to find that he was able to concentrate and apply himself better, as he was able to regulate his emotions. His confidence improved, and he started to smile and even started to laugh from time to time, which his family hadn't seen for years. And that's where I met him, little Kay. He was improved on CBD, but he was far from perfect or normal. And his pains and his muscle spasms still remained an issue. So me and his mum together, we agreed, yes, it was time to consider adding in a THC-containing medicinal cannabis product. Luckily, as per the regulations here in WA, one of his private specialists was brave enough to provide written endorsement for a THC trial, so we could get approval from the state to start treating him. So we ceased the CBD quickly, which is probably down to cost more than anything, and then gradually added in a balanced oil, which means that there was an equal amount of THC to CBD in the oil, 10 milligrams of THC and 10 milligrams of CBD per mil. And he tolerated the treatment really well. He had no side effects whatsoever that were noticed, and rapidly we were able to titrate him up to a total of 1 mil twice per day. His pain was previously, according to Mum's estimates, around 8 or a 9 out of 10 nearly all the time. And she noticed that his pain really dropped down and probably was floating at more around a 4 out of 10, which helped him with his frustration and his sensory overload and his emotions. His appetite improved, his sleep really improved, and now he can sleep for around 8 hours per night. So obviously that's helped not only his rest, but the rest of the family to rest as well. His behavior continued to improve. He can walk further, he can tolerate more exertion, and he started to smile and joke and be happy and cheeky and much more normal again. And now he can even tolerate so much more stimulus and can manage his emotions so much better that the family feel able to head out to trips into the city and visits to museums and trips on the train and so on, and they're more able to feel like a normal family, which of course is just wonderful. So I continue to see him quite regularly, and I continue to try to optimize his treatment, but I'm really happy to report he's doing much better. Nothing is perfect, but he's doing better. For this case, I think my take-home messages are simple and just a few. One, it's pretty fantastic in these really complex cases to have one agent that can help with several problems, to help with pain, behavior, anxiety, sleep, muscle spasticity. And we're just using one agent with one cluster of side effects and one interaction profile to treat all of those issues. And two, quite interesting, makes me wonder if there's going to be a definitive endocannabinoid deficiency syndrome or group of conditions uncovered or discovered soon and defined a bit more closely, because perhaps a large number of his issues can be explained by this theory of maybe not having enough endocannabinoid chemicals on board in his brain and in his body. So I'll leave you on that note. Thank you for listening, and I'll speak to you soon. Bye-bye.
Hi, my name is Dr. Barbara James, and I am here to talk about medicinal cannabis in autism spectrum disorders and my experience as a clinician using medicinal cannabis. Autism spectrum disorders are an area where it's really common to want to try medicinal cannabis these days, and I think that is because children with autism spectrum disorders have a variety of different behavioural disturbances that make it really difficult for them to emotionally regulate in their environment. And it is an extra layer that can help them calm and settle in their environment so that they can manage a little bit more easily. And also so they're more available to learn skills around emotional regulation and calming and soothing. From my perspective, any kind of medication is always a tool of many tools to help calm a child, but isn't the whole answer. And I think that that's the same in medicinal cannabis as with many other medications that get used for children on the autism spectrum disorder. So the observation I've made is that children on the autism spectrum disorder have a variety of difficulties, including reading social cues, sensory overload, and concentration and attention difficulties and emotional regulation difficulties. So these tend to be the core areas that they're struggling in. And adding in medicinal cannabis can add a layer of calming. There are other medications that also can add a layer of calming too, and specifically if there's very high anxiety, I think that there's a role for antidepressants at times, and also if they are struggling to regulate with very high arousal, sometimes medications such as clonidine can be an addition. So the important thing to note is that medicinal cannabis can be added in on the top of those medications. So there are different types of medicinal cannabis that are available, and these range from pure CBD isolates to high CBD extracts with a full plant spectrum, and then higher ratios of THC to CBD, which are also useful. So I have used a variety of these different types of cannabis products in different settings. I've tended to find that children with very high levels of arousal who are constantly on the go seem to do a little bit better with something that provides some immediate calming. And what I've noticed is that products that have a little bit of THC in them but much higher levels of CBD seem to add that level of calming, which can be helpful for the child to then be able to emotionally regulate themselves a little bit more easily. If they're predominantly struggling with anxiety, I do find that the CBD isolate or a high CBD product from a full plant extract is a good place to start. And there's evidence for medicinal cannabis in anxiety as well, and anxiety is a very common comorbidity for children on the autism spectrum. Medicinal cannabis is really interesting because children can respond to microdoses as well as larger doses. A lot of the studies tend to use higher doses, and I've been talking with Daryl Efron at the Royal Children's, and there are a couple of trials underway, particularly looking at high CBD products, and they're tending to use much higher doses in those children, but he acknowledges that clinically he has seen patients respond to lower doses. And this is also important from a cost point of view, because if your child does respond to lower doses, it's obviously going to be a lot less expensive because these products are not covered by the PBS. So it is an out-of-pocket cost to purchase them. So there are a number of studies in Israel supporting the use of medicinal cannabis in autism spectrum disorder with children with behavioural disturbance, and showing that it does have benefit in calming behavioural disturbance. So just talking about the dosing for a second, the way I have tended to dose it is start with very small amounts and then do it frequently through the day, as there does seem to be a wearing off effect. And for children who are very aroused across the day, this can be really useful. A number of children have a lunchtime dose at school as well as a before and after school dose, and then sometimes an evening dose as well. And these are often small amounts, so they might be 0.3 of a mil, some children even 0.1 of a mil, on an oil that has a 1 to 2 ratio of THC to CBD. So that's 1 molecule of THC to 2 molecules of CBD in a given amount of oil. In terms of what I notice that children who are more aroused and who do have a higher level of disturbance, it is more beneficial to dose it more frequently across the day. But sometimes as things settle, the dosage can be pulled back to 2 or 3 times a day, which can be much more manageable. Also, some families find that it's too difficult to give doses across the day, and they may have a child where specific events very clearly trigger them into emotional dysregulation. And so sometimes a slightly bigger dose of the oil just prior to events which are known to trigger them can also be another way of dosing it, so that you don't necessarily give it at regular times through the day, but you might choose across the week to give it an hour before an activity, knowing that your child really wants to do, but that may cause emotional dysregulation. The other area that it gets used in that I touched on before is anxiety. And so the high CBD products are a good place to start with the anxiety, and I find that it calms them over time. So you need to be on it over a number of weeks, and you can find that your child is better able to emotionally regulate themselves and put in place skills to emotionally regulate. And an example of how much they may be on may be something in the order of 40 milligrams of CBD, which of a high CBD, 100 milligrams per mil, might be 0.4 of a mil twice a day. Some children need it a little bit more often than that, but that is something that some children have responded to, both in the primary school age group and in the adolescent age group. In terms of side effects, I find that the side effects tend to only be if you're using higher doses. And sometimes children can be sensitive to the MCT oil, which is the medium chain triglyceride oil, which most of the products are in, and some kids have very sensitive guts and can get a little bit of diarrhea. It's fairly unusual, but that can happen. There can also be a little bit of drowsiness for some children with the oil if the dose is a little bit higher than what they need, and that can be something that wears off over time and that they get used to, or it can be an indication for pulling back on the dose. And the other issue is sometimes the taste, that some children don't like the taste. It does have a fairly strong taste, although most children tolerate that very easily and can have something to eat straight after to get the taste out of their mouth. They're the core areas that I tend to use medicinal cannabis in, and they're some of the ways that I use it. Obviously, I haven't covered everything today, and I'm noticing that I'm nearing the end of my time. But there are currently studies going on, both for children with developmental disabilities and intellectual disabilities through the Royal Children's, and there are other trials underway overseas to look at the role of medicinal cannabis in children with developmental disorders and also in tics. So this is an area of ongoing research. We're still broadening our understanding of and knowledge in this area. But the most important thing is that the families who are observing their children and observing the response in their children often have the best insights about how their children are responding to the oil. It is an area of trial and error a little bit at the moment, because there's differing responses in differing children, and each child has a unique presentation, and the areas of difficulty that are most prominent for each child are going to be slightly different, and hence there's no one template that works for every child. So being prepared to experiment a little bit with the types of dosing is important, because different types of dosing regimes work differently for different children, and it's about finding the one that's likely to work best for your child. Thank you for inviting me to speak today. I know that I've touched on a lot of areas very briefly, but I'll look forward to the questions at the end. Thanks very much.
Now, autism is something that for some reason medical cannabis does have a very positive clinical effect on. Who knew? And yet it is one of the one of the indications for a prescription for medical cannabis legally. And way back in the beginning, when medical cannabis was first legalized, it was one of the very few things that you could actually get medical cannabis for. It was still a fight. And to this day, it's still ridiculously expensive. But one person who has gone down this track and has discovered the value of medical cannabis is Burton Urquhart, and he joins us now. G'day, Burton.
Hello, how are you?
I'm really, really well. I'm really enjoying this tonight. It's always wonderful to hear stories from people that have had extraordinary results. I'm one of them with my multiple sclerosis, and I just feel so happy to meet other people that have had similarly positive outcomes. Tell us about yours. It's not you that's taking it. I believe it's one of your kids.
It's my only son. It's our only son, and we have a 19-year-old teenager with autism. He was diagnosed when he was 18 months old, so over 17 years ago. And, we didn't know too much about autism back then, and, it's come a long way since. We're learning a lot as we go. About the time or after that he was diagnosed, there was obviously symptoms that were a little bit uncontrollable, and we sought the advice of paediatricians, doctors, specialists, that sort of thing, to see how we could maybe minimise these symptoms or control these symptoms. Control is probably a hard word. Minimise would be better. Control is very hard. Minimising is better. And that started our journey of medicine.
A lot of the medicines for autism can be quite strong and can have quite a powerful effect.
Correct.
And, as we all know, autism's a spectrum. So when you take this, or when your boy is taking this medication, what sort of quantities are we talking about, and what kind of effect does it have, or side effect?
Well, let me just add with that he started a cocktail of medicines at a very young age, and we were mindful that it was partially harmful, or it was harmful, is harmful to his health. But at the time that we just didn't see any choice. There was no choice, and we had no choice. And we were more about on the day, so not about 5, 10 years, 15, 20 years down the track. So we couldn't see that far down the track, but we were a little bit mindful, or quite mindful of the side effects that were going to be caused by this. And so, he started off these cocktail of drugs with very minimal doses, having a very little body and, very lightweight, with very little doses. And over time, those doses became, until recently as well, adult-sized doses. Some of them are very high in dosage. So because over time his body had gained an immunity, if you like, to the dosage that he was given, and it surely wasn't enough, and we had to, on doctor's advice, of course, just keep upping them, just keep increasing them, just keep upping them, giving him more, giving him different, and giving him a different one, and giving him another one. And it just went on and on and on and on. And then it got to a point where the paediatrician said, now we're having side effects. His cholesterol levels are up. His lipids are up. This could be causing him high blood pressure. This could be causing him this. This could be causing him that. We've got to change it to this drug. We've got to add this drug. And it got to a point where he was on 5 or 6 different drugs until only recently as well.
What were some of those side effects, Ben?
He's one of his biggest things is anxiety, which isn't under control, but it's the symptoms have been minimised. The anxiety was just crazy. Chronic constipation. His cholesterol level was, and he's just a small kid, even as a teenager at age 16, 17, was a lightweight. His cholesterol was going through the roof. Blood pressure was going through the roof. The drugs weren't having the desired effect that everybody would have wanted, including the doctors and us. And the next step up was, let's increase them some more.
So at some point, someone has mentioned medical cannabis to you.
Yep.
What was your reaction when that was first mooted?
I'd seen programs on, I don't know, it may have been something on TV a couple of times, different channels, different programs. Won't get into the names of those programs. And it started getting my interest, and then I started reading about it. I actually did ask a pharmacist friend of mine as well, and I did say to him, what do we do from here? And he said, in time there will be some medical cannabis, and this is going back 2017, 18. There's going to be a lot happening with medical cannabis in future. Keep an eye on that. So that was another catalyst for me to be mindful of as well. And I was very happy when it became legal some time ago, where we could just go to our doctor and get him to prescribe it for us. So
it's not cheap. Do you
no,
think it's worth it?
It's definitely worth it. It's not cheap. Currently not covered by the PBS, but we think it's very well worth it. Just to let you know that he's reduced his 6 or 7 different opioids to, or I won't use, they weren't all opioids, I guess, but 6 or 7 different medication down to 2.
Wow.
Currently, and smaller doses as well. So in time, we will hope that we can even put them away as well. So
now, previously with the autism medications that he was on, you said that you had to keep increasing those.
Correct.
Since you've been on the medical cannabis, have you had to keep increasing that dosage as well?
No. It's there's probably, that everyone calls it the sweet spot. So just finding that right balance. And remember that, he is taking a bit of his other stuff as well, traditional stuff as well. He hasn't had to increase that. We think we're close to finding the perfect dose.
In terms of the medicine that you're on, as we know, medical cannabis comes in many different forms.
Correct.
I assume that he's on an oil, and if he is, what's the proportion of the 2 main ingredients?
Well, he's on 2 different oils. And the daytime one that we use, and I'm told it's a very low dose, by the way. Am I allowed? I won't mention the brand.
Don't mention the brand name, but you can certainly mention the proportions.
It's the daytime portion is what they call a 10-10 ratio. So
equal proportions of THC and CBD. Correct.
And we've been allowed to use up to 1 ml, so which is 1 syringe.
Yep.
1 full syringe.
Now that's 10 milligrams of THC, 10 milligrams of CBD in 1 dose.
Correct, in 1 ml, correct. So this is a 1 ml syringe. We only use half.
Oh, okay.
So it's wonderful. And then he has a nighttime one because he's had chronic sleep issues. That's a different one. So that's a 20 to 5 dose. So that's a higher dose of THC, and that assists him in going to sleep, because we were currently using up to 12 milligrams of melatonin, which is 6 times 2 milligram tablets.
Yep.
Now it wasn't working.
So when you give the nighttime dose of the 20 to 5, is that still 1 ml?
It's 1 ml.
Yep. So that's 20 milligrams of THC, which is it's a fair amount of THC.
Yep.
From his perspective.
Yep.
And I know this is it's almost a Victorian argument to say, people shouldn't be getting high off medical cannabis. But I've always argued that medicines are either supposed to make you better or make you feel better. Does it make him feel better?
Yeah, it certainly takes the anxiety away as well, and it brings on you know, the sleep, if you like, so easier.
All right.
We still give him a tiny dose of melatonin.
Sure.
That's just to make sure that he gets to sleep.
Are there any side effects?
No.
None
Whatsoever.
apart from having a slightly empty wallet.
Correct. Yeah, his dad's got a bit of a side effect happening, but yeah, apart from that, it's okay. There's no health side effects, and there's no, waking up groggy or anything like that in the morning, which is what he had when he had those other medicines. He was groggy and grumpy, and now he wakes up quite normal, except for what a teenage adult would be like. A little bit grumpy, but that's just a teenage in him coming out. I just want to add as well, a family, well, not a friend of mine that I know from this circle, she approached me out of the blue, and her son is autistic as well, and I think he's a few years older as well. And she's refused to give him anything chemical, and her son's 21 years old, and she contacted me and she said, I refuse to give him anything chemical, but I'm at my wit's end. And she's a single parent as well, wonderful lady, and she said that I refuse to give him anything chemical, but I just can't do it anymore. When he has a meltdown, he goes from 0 to 10, and it can be really unhappy in our household. And this lady is now giving her son medical cannabis, and I haven't heard back from her since she started doing that.
That's really good.
Yeah, whereas I was getting constant phone calls and chats on the phone. So I pushed her over the edge, and she started it as well. And so more like her son did anyway.
Yeah, that's right.
And I haven't heard boo. And every now and again I send her a message and saying, how are things going? And it's always wonderful, much better. So those sort of replies. So,
all right, well, just in closing, thank you for your time, but we are limited as to how much time we've got for the webinar. I'm assuming you'll stick around for the panel, so people can ask questions if they want. But I guess in closing, if you could just say one thing to anybody else that was considering using it, either for themselves or for a loved one, how would you phrase it? What would you say? What would you warn them against, or what would you encourage them to do?
Well, my thing is all about the family. Do it for the family, because a healthy loved one or a better loved one is a better family unit. And our family unit is 10 times better for it. So I have no warnings. Do your research. It may work for you, it may not. Do your research, and you've got nothing to lose, except maybe a better quality of life for the whole family.
Brilliant. Wonderful. Burton, thank you so much for your time, and we'll have a chat a little bit later on.
Absolutely. Look forward to it.
Good evening, everybody. My name's Sharlene Mavor. I'm a medical scientist. I'm also one of the directors of Medical Cannabis Research Australia. I'm going to be talking to you briefly tonight about autism spectrum disorder and clinical trials and evidence. We believe the endocannabinoid system is involved in autism spectrum disorder due to evidence in animal models. We believe that the endocannabinoid system is disrupted or dysfunctional in these models. One published paper demonstrated that mutations in 2 genes that predispose to autism spectrum disorder disrupt endocannabinoid signaling, and a second showed a number of alterations of the endocannabinoid system were measured in a rat model of autism spectrum disorder. These papers also indicate that deficiencies in anandamide, that THC from cannabis mimics, are apparent in autism spectrum disorder. Further early evidence has come from limited human research. The first study has shown that cannabinoid receptor type 2 is upregulated or shown to be present in increased numbers in white blood cells of children with autism spectrum disorder, suggesting that the CB2 receptor is a potential therapeutic target for autism. The second study showed anandamide levels, as well as other endocannabinoid levels in autistic children, are lower compared to neurotypical controls. There are at least 7 convincing low-level trials undertaken with medicinal cannabis and autism. 3 of these small trials were in Israel, and they used high CBD products containing THC at roughly the same proportion. Improvements included significant quality of life, mood, but it's also interesting to note that not everybody improves. There are also some adverse effects reported, including increased agitation, sleep disturbances, and restlessness. One of the Israeli trials actually used a product which will be soon available in Australia. In this particular trial, it was a controlled study of 150 participants, and they used a whole plant extract containing a 20:1 ratio of CBD to THC. This improved disruptive behaviours on one of 2 primary outcome measures, and on a secondary outcome, an index of autism spectrum disorder core symptoms with acceptable adverse effects. One of the studies was also an Australian study, and I want to tell you a little bit about that one. So this is a study that was conducted in Victoria at the Murdoch Children's Research Institute at the Royal Children's Hospital. This was run by Associate Professor Daryl Ephron. So this was a CBD study to reduce severe behavioural problems in children that included autistic children. This was a pilot study, and they used a 98% pure CBD and used a fairly high dose. 4 of these participants were on active drug and 4 were on placebo. They noticed an efficacy signal in favour of the active drug, and there was an increase in all autism behaviour checklists. In that way, they had good results. All parents reported that they would recommend the study to other families with children with similar problems. There were no serious adverse effects or dropouts, and this trial is going to progress to a large funded RCT. I'm just going to play you a short video describing these results and following one child.
Medicinal cannabis is being used to help manage the behaviour of children with autism and learning difficulties. A Melbourne study has found the substance reduces anxiety and agitation, with the encouraging findings opening the door for a much larger trial. Madeline Slattery has more.
18-year-old Sebastian lives with severe autism and learning difficulties. Do you want to say hello to everybody? Hello. In the past, his extreme behaviour has seen him run away 6 times and end up in hospital.
At one point, he went through a glass door, and we ended up here at the Royal Children's. Almost lost his eye, had a cut there, severed his arteries on his wrists, taking his seatbelt off and opening the car door.
But for the past 7 months, he's been taking medicinal cannabis. The substance doesn't contain the high-end juicy THC component. Instead, it's cannabidiol. His mum, Ratan, has noticed an improvement.
A reduction in his agitation and also in his anxiety, and he's just more evenly emotionally regulated.
Sebastian was one of 8 children with severe behavioural issues on a small-scale trial at the Murdoch Children's Research Institute.
4 on active drug, 4 on placebo, and those on the active drug, they did much better than those on the placebo. They don't get a high from the cannabidiol, but they feel calmer.
Researchers also found cannabidiol's side effects are less severe than existing treatments.
And they have a high risk of side effects, things like weight gain and also sedation and cognitive blunting. So pretty serious side effects.
Following the promising early findings in the pilot, the team has been given a federal grant to expand the trial to 140 children. It's hoped more definitive results will lead to changes in clinical care guidelines.
You'll try anything that's particularly that your doctor is recommending.
Madeline Slattery, 9 News.
Okay, So lastly, I just wanted to talk to you about a clinical trial that has been announced, which is an observational trial. It's being run by a commercial group called Zero Therapeutics, which are a drug discovery company. They'll be running this trial in the Emerald clinics around Australia. So they'll be taking participants aged 6 years and above, and they will require a supporting letter from their paediatrician if they are under 18. Now they're hoping to prove and show, does a one-to-one product CBD to THC or a high THC product improve autistic behaviours, parental stress, and improve sleep. They'll also be looking at adverse effects. They'll be followed for 6 months, and they're hoping to recruit
said to me, meet me down by the gallows tree, for it's sad news I bring about this old town and all